in the sport and physical activity team at Derby City Council, and as part of that, lead on our falls prevention activity programme that I'll be talking a little bit about later on. Just a couple of housekeeping things to start off with. So could we just ask that everybody turns their microphone on to mute until later on in the call, just so we don't get feedback. We know that some people might be joining us on their lunch or travelling in between meetings. So if you can have your cameras on, that's great. Always nice to be able to see people's faces. But if you're just listening in from the background, no problem at all with that. We are going to be recording this space in a moment, although I think Adam's actually even already started it. We're going to be recording the space today, just so everybody's aware. We're going to share that with everybody afterwards, along with the presentations that you'll be seeing today. We'll be sharing those with everybody afterwards as well. We'll be making a start in a second, but as we're going along, please use the chat function that we got on the Teams call today to introduce yourselves. So if you'd like to use the chat, just introduce who you are and where you're from today, just in case you happen to see anybody that you might want to connect with after today. It's always great to know who's on the call. And just finally, as we go throughout today, there's going to be 2 presentations to begin with. If you've got any questions that come to you during the presentations, please also feel free to use the chat to ask any questions that you might want answering a little bit later in the call. And Adam and ourselves will be keeping an eye on the chat. So without further ado, I'll just share the first sort of couple of slides that we're going to be having a look at today. And if Adam could just give me a verbal confirmation when you can see that, so I know everyone can see it.
Yeah, I can see it.
Great, thanks, Adam. Well, so yeah, as I say, welcome, and just let you know a little bit how we're going to go with the space today. So this is the first meeting of the Derby City Falls collaboration space, which has come together from some conversations based on a number of people from lots of different organisations in the city who work around falls prevention, and we want to try and provide a space for people to learn a little bit more about what's happening in the city around falls prevention. So this space today has been put together by a group of partners from the City Council, from Team Up Derby, the Community Falls team, Derby County Community Trust and Active Derbyshire, all to try and provide this space for you to learn a little bit more about what's happening in the city. We're going to have a presentation from Team Up Derby around their enhanced health and care homes work. The Derby City Council Sport and Physical Activity team, so I'll be presenting around our Forever Active programme. Then we'll have a little bit of chance for people to ask some questions. So as I say, please do feel free to use the chat throughout if you've got some questions that you'd like to raise a little bit later on. And then at the end, we'll just sort of wrap up a little bit with some next steps in terms of this space and how you can support moving forwards. Just to give people a bit of a reminder around the Falls collaboration space. So we're just aiming to highlight the work that's taking place in the city and very much want to give people the chance to learn about what's going on, come together and hopefully share some information. And we'll be getting some feedback from people at the end of today just to see how you found this first meeting and what you might want to hear and learn from this space moving forward. So that's everything from me for the moment, and I'm now going to hand over to Ella Cundall and her colleagues from Team Up Derby City, who are going to present on the Enhanced Health and Care Homes project.
Hi, my name's Ella. I'm the physiotherapist with Derby City Team Up. We're just presenting today to sort of talk about enhanced health and care homes. It's one area of falls in the community that we're looking at the moment. And I've got a few members of the team with me here today, but I'll let them introduce themselves when we get started with the presentation. I'm just going to share my screen. Can you see that?
We can, thanks, Ella.
So for those of you who don't know sort of about what the Team Up concept is, it's very much a concept, but it is sort of, it's allowing teams to come together and professions to come together to look at all of the things we've been looking at separately and sort of have a collaborative delivery of better healthcare across Derby City, and they have got enhanced health, they have got Team Up in Derbyshire as well. So Enhanced Health and Care Homes project is sort of a set of guidelines for best practice for providers and stakeholders to work together to develop better healthcare in care homes. It was a framework first published in 2020. There is a link at the bottom of the presentation that will be sent out to you if you did want to have a look through the very lengthy framework, but it does sort of outline the aims of enhanced health and care homes. So within Team Up, we're sort of the goal is for proactive care centred around the needs of the residents and their families, aiming to maintain people's independence for as long as possible, helping the staff in the care homes feel at the heart of the team, and especially looking at falls, making sure they feel at the heart of the falls prevention services. It's looking at budgets and incentives, making sure they're aligned so they can work together to improve people's health and well-being, and looking at the health and social care services are commissioned or coordinated in sort of a coordinated manner, so we can properly understand the needs and make sure people are getting everything they need from health and social care. Okay, so I'll go on to talk.
Just to let you know, you've got onto mute, Ella.
Sorry, I'm back. We've got Dr. Annabelle Stewart, who's leading on the Enhanced Health and Care Homes project within Derby City, our ACP, Leonie Nowak. We've got our GP assistant, Esther, who's with us today, the senior clinical pharmacist, Vicky Starkey, who again is with us today. We've got pharmacy technician, Jane Thorpe, who's working with Vicky. I'm working as a physio in Enhanced Health and Care Homes. We've got 2 Admiral nurses, Sophie and Steph. We've got Keith, who is with us today from the Derby County Council, who's a health and wellbeing coach. Now, you're with Derby County Community Trust. So we started looking at the data and looking at falls in care homes. Through the MDTs and working with the ECPs, we're finding that some care homes were stating they had a no lifting policy. And so we've done some work meeting with regional managers and identifying individual cases of falls that needed sort of escalation and support and training for the care homes. We're linking with the county, the city council to look at quality monitoring the care homes. We've got data from care homes only looking at the falls that were transferred through EMAS to acutes. We're looking at the demographics, finding out why those people are falling. Is there something that they're sort of something we can capture all of those patients in? Is it multiple things? We're looking at the anti-cholinergic burden scores, and we're asking for certain information from EMAS and ECP notes, so we can really look into why people are falling and do sort of more thorough data investigation into that. I'm going to hand over to Esther to talk a little bit more about the data.
Okay, hi, my name is Esther, I'm GP assistant with Team of Derby. Like Anna said, we gathered data from 30 care homes within Derby, and then also the data from February to July, and we're able to look at 114 patients that had EMAS call-outs due to falls, and we were finding that some of the risk factors that was associated with them were that they about 110 of them had fallen, who had fallen were around 65 years old or older than that, and we know that that people who are older from 65 years of age have that tendency of falling, and it also correlates with that with available evidence. Also, we found that some of them have had previous history of falls, and many of them, about 71 of them, had multiple drug use, which is basically looking at the risk factors associated with the falls. And also, we saw that we had to break down the medical conditions that were associated with them falling. And we saw that many of them had cognitive decline, like patients who have dementia, and then other variables we also looked at aside that were people that were on blood thinners and all of that. And then the purpose of looking at these data actually was that we wanted to find out, using the enhanced care framework, since he was focusing on falls prevention, we wanted to find out, okay, what was happening to patients in care homes that were falling and how we would be able to support them being able to identify the common problems that they were having. Thank you.
Gonna hand over to Keith and have a being coach.
Hi there, folks. As Ella said, my name's Keith and I work for Derby County Community Trust in conjunction with the team up in Derby. So my purview is I'm working within care homes to help get activity started in there, maybe in places that don't already have activity or minimal. So my main goals for going in there are working on sort of strength, mobility and stretch work with chair-based exercise, games, also social interaction as well. You have plenty out there who might not even know the person sat next to them in those sessions. So it's a good way of just getting the social interaction within the actual homes themselves. And also what we'll look at doing is signposting to some of the services that Derby County Community Trust do. So we run things like coffee mornings, knit and natter groups, do stadium tours. We've got a session called Sporting Memories, which is to help with the dementia patients out there, which is run on the first Monday of every month. And that's just going through and using Derby County as a way to spark memories within people. At the moment, I'm currently working in 3 care homes. Ideally, I want to be sort of working in 10 or up to 10. So there is scope there for sort of getting bigger with regards to that. So I'm always open if people have ideas within the city or places that they know of or that sort of side of things. I'm open to those ideas, and I'll be able to forward to me any information that people can get. Currently, there's no plans to withdraw support at the moment. So it is an ongoing thing, and hopefully we can get it going and get it in as popular as possible. Good to speak to you guys.
So the falls prevention work that I'm looking at in care homes in the city is looking at sort of addressing the modifiable falls risk factors. So with some of the care homes, I'm going in and advising them to download the React to Falls app. And for those of you who don't know what that is, it goes through sort of each section about what can increase somebody's risk of fall and what actions care homes can take to reduce someone's risk of fall. What I have found is that a lot of care homes to escalate somebody's falls risk to try and reduce it in the future, they're referring on
ready then. I'm going to go get some.
They are referring onto the falls service or referring to community therapy, referring to CASEB, but actually there's lots of stuff they can be doing in the care home to reduce somebody's risk of falling. So that's sort of aiming to get them to be looking at that and seeing what they can be doing. I want sort of care home staff to feel empowered and to feel competent to be at the centre of falls prevention, because ultimately obviously they're the ones who spend so long with the patients, and if anyone's going to be able to do anything effective to stop these people falling, it's going to come from them. To support with that, I'm looking at the Managing Falls in Care Homes document that was first published in 2011, and it's got some really, really good resources on it about sort of what can care home managers and owners be doing to reduce risk of falls. And I wanted to sort of create a document for carers, senior carers and care home managers to understand where they sit in falls prevention, and promoting everyone that's working in care homes to assess a resident's fear of falling, as well as whether they have actually fallen, because as we know, somebody's fear of falling, their perceived risk of falling is huge to reduce their risk in the future. So that's what I'm working on at the moment, and obviously it's a very big project working on falls in care homes. So if anybody wants to get in touch about sort of the work they're doing, that'd be fantastic. I'll hand over to Vicky, our pharmacist.
So hi, my name is Vicky Starkey. I'm the senior clinical pharmacist within the team. Our team consists of myself, and we also have Jane Thorpe, who is our pharmacy technician. Currently, we've been supporting Heatherton House, which is a new care home that Primary Healthcare Derby manage, and we're providing support around medicines reconciliation following hospital discharge and for new residents. And we're also doing comprehensive structured medication reviews. One of the pieces of work that we're looking at is the anticholinergic burden score of medication. So we've done an audit of some of our patients and looking at how the scores relate to falls. So I've been working with Esther on her audit. So we've been having a look at the patients that have fallen and if they have high anticholinergic scores. And we're aware that a higher anticholinergic score can cause cognitive decline and also improve cardiovascular outcomes and can be one of the factors of a fall. So if we can reduce the burden, then we can try and prevent falls. We've also been supporting the care homes with medication queries. We're working on issues around urgent scripts not being issued in a timely manner. And we're supporting the care homes around the organisation of their medicines and trying to reduce the amount of mismedication in residents, which then could also contribute to falls. And another area we're starting to look at is bone health.
So Sophie Dodsworth and Stephanie Clark are our two Admiral nurses who couldn't join us today. I'm just going to hand over the work they're doing in care homes. They are working in community as well. The role of Sophie and Steph is to support enhanced working care home staff and all the ECPs to support people living with dementia. They can offer specialist advice and signposting to the most appropriate services. Obviously, there are already a few services available to patients with dementia. There's the community mental health team, which mainly focus on severe anxiety, depression and psychosis. There's the dementia, there's the DRRT, who only sort of support people if they're at risk to themselves or others, and the dementia palliative care team, who look at people sort of towards the end of their life with advancing dementia and look at symptom management. So anybody that doesn't sit into sort of those categories are somebody that Steph and Sophie can support with in community and in care homes. The goal for them is to support families and clinicians with complex decision making, and if relatives or patients are struggling with a dementia diagnosis, they can support them to maintain healthy relationships, especially considering in care homes when people get their relatives admitted, there's quite a lot of guilt around that, and so they're doing a lot of work with people on a one-to-one basis to support them. And they're looking at the Diadem tool, which is a tool looking at diagnosing people with advanced dementia, with mixed dementia, so they don't have to go through the memory clinic assessment if that isn't appropriate to them. So in terms of falls and how our Admiral nurses are supporting with falls, they're supporting with the education of care home staff, and sort of looking at the importance of delirium prevention and treatment using Pinch Me, and looking at the non-pharmacological strategies and advice around the care home environment for people living with dementia, which has been able to decrease their risk of falling. Here, this is just to look back on once the presentation's been sent out. There are a few of the other project plans we've got, but if anything sort of relates to what people are already doing, or you want a little bit more information around anything we've spoken about or the project plans, then please do just get in touch. My email will be accessible to everybody through the things Alistair is sending out. And then any helpful resources. So this is sort of the framework of enhanced working care homes if you want to understand what we're trying to deliver a little bit more. And then a few other bits that you can take a look at if you feel it's going to be helpful. Has anyone got any questions from sort of the enhanced working care home stuff at the moment?
There's a few from Sarah Ballin. I don't know if Sarah wants to ask a few questions directly.
Hi, yeah, sorry, I've been typing away. So I'm a director of Cotsbent Residential Home, as well as being the director of Let's Get Active UK Limited. There's quite a few things that I was asking in the chat. Are care homes actually aware that you are doing this?
At the moment, we're sort of at the start of rolling
Right.
everything out. So as and when we, yeah, so
we've got literally no idea that you guys are doing anything like this. And obviously, if you're doing it, I'm not doing this to get at you, but if you're doing it for care homes, they can tell you everything you need to know.
Yeah, yeah.
Especially with the digital care systems that care homes now have to have in place in correspondence with the CQC, they actually collect all the evidence for you. So you can literally download it from the digital care systems. It's all there. And you can also access all of the data that you need to be able to say, right, reduce falls this much, that much, next thing. It's fantastic. So yeah, definitely link in with care homes themselves, because they'll make your job so much easier.
Yeah,
make life so much easier.
Yeah, that sounds brilliant. I'll definitely get in touch with you about that.
Yeah, and so obviously the data that you got from care homes, Was that just obviously you were talking about bigger care homes, not independently run care homes, and is it residential nursing or dementia that you've got all the data from?
So the data we've got is from the EMAS conveyances. So it's only when an ambulance is called, that's the only access sort of we've got at the moment remotely. And so that's where that information has come from. And
so you're not catching the falls that are happening in the home that don't involve EMAS?
Not at the moment, no.
Yeah.
But you know, we do really appreciate the input from care homes. It'd be really helpful. Like I say, what we're doing at the moment is very much the first steps, and so we're sort of getting plans together about what it is we're looking at and we can offer before we're gonna go out. But I know our Admiral nurses, Steph, has been out to every care home in the city, and sort of trying to promote getting dementia champions, and she's delivering training once a month over Teams. On how to support residents with dementia. So
are you focusing, sorry, there's loads of questions, it's just because I'm in the industry. Are you focusing on just the dementia, or are you focusing on residential homes and nursing homes?
Residential and nursing. We're looking at.
So you're focusing on everything, you're just getting the data from the dementia stuff at the moment?
So the data from falls is the only data we've got at the minute, and that's from everyone, including those not diagnosed with dementia. But in terms of sort of when we've gone into care homes, that's the Admiral nurses at the moment are probably a step ahead in terms of like getting out there. Yeah.
I get you now. And there's one question, sorry, that I did, but I'll shut up in a minute. I'll ask everyone else ask questions. There was one question that I asked for Derby County Community Trust. So Keith, your funding, obviously Derby County Community Trust have little pots of funding, don't they? And they go into places with little pots of funding. When we've had Derby County Community Trust come to us, they've only been able to work with a specific type of resident, which is why we've not been able to work with Derby County Community Trust. Okay. Is this for any resident who lives in a care home, or are you looking for a specific type of resident in a care home?
With regards to this, where I can work with anyone within the care home, so I believe there's 86 in the city. So I'm going around sort of each of those care homes and sort of gaining interest at the moment and sort of seeing which ones would be interested in the service that I'm offering.
So it is funded via Derby County Community Trust. The homes don't have to pay anything.
That's correct. It is funded. Brilliant. So yeah, it is free.
Okay, fantastic. Yeah, that's it. Sorry, I'm quiet now.
Great, thank you, Sarah. No, thank you for those questions. That's really great. And we're going to have another presentation in a moment. But whilst we've got a couple of minutes, does anybody else have any other questions they'd like to ask with the Enhanced Health and Care Homes team? Phoebe, I can see you've got your hand up.
Yeah, I was just going to ask if all the data you're looking at is specifically related to care homes, or if you're looking at falls in general that happen in people's homes prior to care home admission or anything like that.
So at the moment within our team, we're just looking at care homes. Obviously falls across the city is a huge project, and definitely, you know, we want to do a lot of work there, but it's sort of how to capture the data and making sure it's not growing huge before we can sort of make a really good plan for care homes as well, because that's the Enhanced Health and Care Homes framework is sort of what we're focusing on in this team at the moment. But falls in community is something that, you know, I'm looking at, but it's just capacity wise really.
Yeah, because I sort of work to support a community team, local area coordination and localities as a whole. So a lot of their work is sort of, you know, prior to the person, you know, having a place in a residential home or care home. But I'm interested in the data around the falls that happen prior to that point. So I was just wondering if you still have that, or if you know who I could maybe get in contact with.
Not at the moment, but I'll make a note of your name and I'll have a chat with the person who sort of supports us with data and see if that's something they can help with.
Oh, great. That would be great. Thank you.
Great. Thanks, Phoebe. Can't see anybody else with a hand up at the moment, so please do stick it up if you want to ask. But also, we're going to go on to another presentation now, so please do use the chat. So Sarah's put quite a few questions in the chat, and thank you for that, Sarah. So got a presentation just for you all now around some of the community falls prevention activity programme. So any questions that come up through that, please feel free to put them in the chat, or we'll have a bit of a chance like we've just had for some questions afterwards. So I'll just share my screen again, and Adam or Ella, if you could just let me know that it can be seen, that would be great. Apologies, because that's the wrong mate. Great. If Adam or Ella could just give me a shout, say that that's come up.
Yeah, I can see that.
Great, thank you. So as I mentioned at the start, I work for the sport and physical activity team at Derby City Council. So I'm just going to give you a bit of an overview about our team and our work, the Forever Active programme that we administer to support older people, and just what this might mean to your work in the city with the people that you're working with. So firstly, just in terms of our team, we work with people of all ages in the city to support them to be physically active. So we work quite closely with public health and lots of partners both within the city and within the city council and other organisations. This is a little bit of information about our team. So within our team, we have a structure where we work across lots of areas in the city and also lead on particular demographics. So as you can see with the boxes that I've highlighted there, myself and my colleague Andrea lead on our active ageing work, which is what we're talking about today in terms of supporting older people. We're really keen to work across the city to try and encourage people to be more physically active and to see what role activity can play in supporting people's health and well-being. And to do that, we just make sure that we try and focus on particular areas so that we are focused, and that's where myself and Andrea try and work with partners such as the Enhanced Health and Care Homes team to support older people to be active. So in terms of the Forever Active programme, it's to support active ageing. So it focuses on strength exercise and stability, and it's as much as getting people active, it's about reducing the risk of falls. So this is the information posted that we give out to people to give them a bit of a background to the programme. Our main aim is to try and signpost older people to activities that are locally for them. So we are essentially trying to support people to find things that they can take part in. So we know that hopefully if people can find activities to take part in, it will improve their physical health, but also there's a massive social benefit to people doing that. So based on what people are looking to be, we'll have a conversation with them over the phone and try and find out whether there's a suitable activity for them. And I'll just come on to talk a little bit more about how that process works. So this is a little bit about the pathway for people that are coming through to our team in terms of how that process works. So we take referrals from professionals. So we do take referrals from the Falls Clinic and from the fire service, for example, for people that are perhaps worried at falling or have had a fall. But we do also take self-referrals as well, so people can get in touch with us just to say that they are interested in being more active or would like to find something that's local to them. Once someone's been referred through to us, we'll have an initial conversation with them. So one of our advisors in our team will have a conversation with that person to try and find out what sort of things they're interested in, just to understand what their sort of physical ability and their confidence is, and to try and give them some opportunity to tell us about things that they might already know about but haven't tried, or certain activities that they might be interested in having a go at. We'll then look to use that information during the conversation to try and signpost them to an activity that's suitable, or we'll go away and try and find out using our sort of contacts and our networks and the things that we're aware of in the city to find a suitable activity for them. And that does include falls prevention activities. So we will look to support people who've been referred to us that are worried about falling, or someone that says to us that they're a little bit more nervous about being active. There are some falls prevention activities within the city that we can signpost people to. And then once we've sort of recommended an activity to someone, we don't just leave that there in terms of our input. So we'll look to try and support that person over the telephone to try and attend that activity that we've spoken to them about. So hopefully once we've managed to agree something that they feel like they're able to go to, we'll keep in touch with them. So we'll arrange to get back in touch with them and discuss how hopefully they've managed to get on when they've been to that activity, or just make sure they've got all the support that they need. And we'll also work with referring partners where possible. So particularly with social prescribers, once we've sort of had a conversation with someone and signposted to an activity, we'll keep in touch with the social prescribers just to try and give them the tools that they need to support that person as well, to try and go and regularly attend that activity. Once someone's regularly attending an activity, particularly if they've gone to a class or an activity that we know is being led by an exercise professional or somebody that's facilitating that, we will sort of hand that person over to that. So obviously in terms of our capacity, we're aiming to try and make sure that people can find something that they can take part in. So once they're taking part in that activity, we kind of leave them to be supported by that person that's either the instructor or is leading that activity on a regular basis and can be their support network. So in terms of the falls prevention activity offer within the city, the main offer that's available is classes called postural stability exercise classes. So if you're not familiar with postural stability exercise classes, they're an evidence-based program that helps you reduce falls. So it consists of three main elements, which are aerobic, balance and strength exercise. And all of this also has a massive impact on people's coordination. So that all obviously helps to reduce their risk of falling through taking part in these weekly classes. And there is a massive added social benefit. So almost all of the postural stability classes that we support have a social element afterwards where people can stay for a tea and a coffee. In terms of our team's involvement with this process, so it's not classes that are delivered by the City Council, it's a community-based offer. So there are independent instructors who are delivering. At the moment, we've got 11 weekly postural stability classes in the city. We support these instructors and quality assure these classes. Obviously, from our perspective, we're really keen to have as many classes as possible to be able to refer people into. But essentially, the instructors are delivering a sustainable community offer. So people would need to people pay to attend these classes. It currently ranges between £3 and £5 for people to attend, and like I say, those are all weekly classes. Outside of the postural stability classes, we are also working at the moment to just grow that offer. So we're hopefully at the moment just looking at adding a Tai Chi class to our programme so that we'll be able to refer people into Tai Chi, which has a massive impact on people's balance. And then there's two other exercise offers that people might be familiar with. So Atargo is another evidence-based exercise programme, and we're currently working to develop some instructors who will be able to deliver Atargo, including Keith, who you heard from earlier. Keith's going on that course shortly as well. And then there's another exercise programme called Move It or Lose It, which is a more movement-based exercise programme. And we're just working with an instructor to add some Move It or Lose It classes to our programme. So we very much look to try and support people to be able to access these programs and to support the instructors and to grow that program of community exercise classes. For people who might be familiar with the Strictly No Falling program in the county, we have a very similar approach to them in terms of supporting community-based activity that's delivered by independent instructors. So just coming back to our sort of model of how we work with people, to give you a bit more information about that referral program, as I mentioned earlier, so just listed some of the partners that we currently receive referrals from in the city. That's not the extensive list, but we also have a self-referral program as well. So this Forever Active program is open to support older people. So generally we find that we're working with people aged 60 plus, but from our side we aren't restricted to working with a particular age group. So our main aim is to support older people to find activities that are suitable for them. So within that, it's thinking about activities that are socially suitable for older people. A lot of the activities in classes that we refer into are generally attended by people older, age 60 plus. Once we get through to the stage of sort of recommending the activity, this isn't necessarily the only sort of route for people to look who are looking to be physically active within the city. We work really closely with partners, including the Derby County Community Trust and the Live Well service that we work within the city, where people might be interested in a particular activity. So swimming is a great example. We get a lot of people who are interested in swimming. We're able to sort of signpost them on to Moorway Sports Village, which is run by Everyone Active. So this isn't necessarily the only way for people to get support to be active within the city, but what we try to do through this program is make sure that it's led by the individual. So if they're particularly worried about falling, we're able to signpost into specialist falls prevention classes. But also we get a lot of inquiries from people who are just looking to find activities or may have an interest in an activity that partners such as Moorways or the Derby County Community Trust can also provide. So if you're a professional that's working with an older person, at the moment, in terms of referring into us, we're really keen to support you where we can. And at the moment, our referrals are done via email. So as you can see, there's just a little bit of information that we generally ask for so that we can have as good a conversation with the people that you're signposting to us as possible. And what we'll do, so once we receive that information from you, we'll make contact with that person via phone if possible, and if they're happy to do that, or we can do it by email if required, just to look at what sort of activities might be available to them or what they're interested in. We are currently just working on an e-referral form, so we are conscious that that's not necessarily the most easy process for everybody, and particularly for those that are getting in touch with us as a self-referral. So we are just in the process of getting an e-referral form, which will be made available for self-referrals and also professionals who want to refer into, hopefully use it in a bit more simple way to refer into the programme. finally, for me, just wanted to give a little bit of feedback. So obviously what we try to do is get out to our sessions and just find out what it is that people take from the programme. So these are just a couple of quotes that we've had over the last sort of 12 to 18 months from people that have been referred through ourselves and have gone to take part in either an activity that we've signposted into or a falls prevention class in the activity. So as I touched on earlier, the physical activity is the element that we're trying to support most with, but we know that there's much wider benefits that people get from attending these classes, including impacts on the day-to-day life and the social benefits that they get from it as well. So that's everything for me. I think if you are working with older people and you don't currently refer into us, or you'd like a conversation about our programme, please do get in touch with us. Our email address is there on the slide, and we're keen to support and find out how we can help older people that you might be working with to take part in activity. So I'll just stop sharing my slides. And I'm just going to hand over to Adam and Ella just to see if we've had any questions that have come up whilst I've been presenting in the chat.
Can't see any questions in the chat, but I know Sarah's got a hand up. Sarah Douglas. Oh, I think you're on mute, Sarah.
Help if I took my mic off. Hi, I'm Sarah. I'm one of the occupational therapists from the Falls Clinic, so CASUP over at London Road. I know obviously your focus is on getting older adults moving more, but my question is there anything out there that focuses on education? So I know as a service we provide education in accordance with Otago groups, and we've sort of split that down into 8 different sections of education. And I think the move more is brilliant, but I think when patients understand the meaning behind needing to move more and self-care, the motivations behind engagement is much better.
Yeah, great. Thanks for that, Sarah. And we obviously get quite a few referrals through from CASOP from yourselves, which is a great route for people to carry on being active. I mean, I'll let others come in a moment, but in terms of our programme, we use the staying steady, get up and go guides is something that we try to support people with. So as part of the social element that the instructors deliver with the class, we do try to get out and go. So myself and Andrew, who are part of the program, try to get out and use those booklets as one tool to give people some more education. So absolutely, as you say, we're trying to encourage people to both attend the class and carry on being active sort of beyond the once a week that they're going to a class. So we use if people aren't familiar, the Get Up and Go Staying Steady guides are a really great resource that are recommended by DCHS and Public Health within Derbyshire to give people some advice around things at home, how they can just have a think about their day-to-day life and things they can do to reduce the risk of falling. We do try to pick up an element of that when we have conversations with people over the phone as well. So we're not falls prevention education specialists, but what we try to sort of add in terms of the value through our programme is when we're having that conversation, we are talking about some of those things that hopefully will encourage people to think about falls as a whole. Obviously, we're looking to try to support them to go along to a falls prevention class, but we do sort of try and touch on anything that they might be struggling with at home that might have sort of led to them being referred to us. So if they are struggling with particular things at home, we'll try and just talk to them about how exercise can support that and how going along to a weekly class, as well as the social benefits, how doing weekly falls prevention exercises can help to sort of impact on their risk of falling. Ella, was there anything else from you on that in terms of the education side for falls?
I don't think so. It's looking. Am I echoing to anyone else? No.
That's okay. You should be all right now.
Brilliant. Thank you. Obviously it's really important with falls to understand why exercise is important, but it goes beyond that as well, doesn't it? With lots of different health conditions and the impact exercise has on it. And I know there are a few different pilots across the city looking at pre-diabetes and looking at weight loss that Analysis has been involved with. So it's definitely something that everyone recognises is a huge area. But I think that's where, with the enhanced having care home stuff, we're really wanting carers to understand as well and sort of getting that education out from a carer point of view. And I know that doesn't necessarily sort of go out across the whole community, but it's just a starting point, isn't it? But yeah, really important. I can't see any other questions for you, Alistair, at the moment.
Great, thanks, Ella. So yeah, if anybody has got any other questions, they'd like to pop the hand up. But if there's not any specific questions relating to the presentation, we probably just sort of open up at this stage. So as we sort of mentioned at the start, we're really keen to provide a space for people to have a conversation or to share their experiences of working in the city. So if anyone's got anything that's resonated from them through the presentations around force prevention or anything that they'd like to raise, now's the time really. We're keen just to open it up for a bit of discussion. And I can see that Sally's put her hand up. So Sally, please feel free to come in if you've got something you'd like to raise.
Hi everyone. I'm sorry I was late joining. I got held up, I'm afraid, and I'm not got my camera on because I'm on my phone. So apologies. It might have already been covered, but from a lack point of view, I am always sort of very conscious to try and encourage people to go to these sort of groups and just generally try and exercise more. But is there anything medical that, so I'm just thinking aloud a little bit. There's a chap I've met very recently who I feel would really benefit from some exercise, but he has a lower back problem. Do people in Move More request any medical tests or go to the GP or anything like that before you start on a programme?
So that is something that is sometimes picked up through some programs, but for ourselves, we are mainly just that signposting support for people that would like to be more physically active. So, as an example, Sarah touched on earlier from the CASOP community comprehensive assessment service for older people, which is the Florence Nightingale Falls Clinic. They will send us through some information around the patient, and obviously they've been working with them for a number of weeks to be able to support them to be more ready to be active. So I think the way that we try to support that is we'll always be happy to have a conversation with them. So myself and Andrew, who manage the referrals, we're happy to either have a conversation with yourself as the referring professional to start with, if that's appropriate, or happy to have that conversation. We won't take any sort of tests, and there's no criteria as such for our classes, but we will very much just try to talk through what the class looks like for the person. The instructors are delivering the postural stability classes have had quite extensive training around their classes and what they can deliver. They will adapt their activities. So I didn't touch on in the presentation, but the postural stability is a mixture of chair-based and standing. So it's all about encouraging people to be as active as possible. But for some people, obviously doing exercise seated is more appropriate. So as well, when we've had a conversation with someone, we can talk through with them in terms of their condition to understand whether or not they feel like it's something they'd be suitable to do. They are also able to go along to a class and see it. So if they'd like to go and have a look at a class, see what's entailed, or have a conversation with the instructor, that is something that we're able to offer, but we don't necessarily have a medical criteria. Obviously, I guess what we'd probably suggest, Sally, is if you've got concerns about that individual, it's maybe looking for them to sort of try and get some to go back to their GP, for example, if there's something that you feel like their GP needs to have some input in. But I can also see that Ella's got a hand up, perhaps to come in on that point as well.
Yeah, just from my sort of physio background, what I'd suggest doing is getting the patient to self-refer through the GP. There are physios in quite a few practices now in the city that can see the patient instead of a GP, so it's not that we're taking a GP appointment. And from there, if they talk about sort of their concerns around wanting to do more exercise, if they feel their balance is getting worse and they've got this back pain, that's something the physio can sort of escalate. Once they feel they've treated that part, they feel safe then to engage in exercise. I think that's then when you could tap into Ballister's service.
Yeah, that's lovely. Thank you. That's great advice. Thank you.
Thank you. Just going back to Sarah's question, Sarah Borlin, about sort of what care homes are aware of with the Enhanced Staffing Care Homes project. We've got Annabelle here now, who's our GP, sort of leading on that. So I'll just pass over to her for a minute.
Oh, hi. Yeah, I'm Annabelle, like Alan's just said. This looks fantastic. I've just joined for the last little bit, so yeah. Derby City, we have ECPs going into each care home once a week with support from the aligned GP. So I'm assuming that Sarah, you have, was it Sarah?
Sarah Borlin, yeah.
Sarah, I'm assuming that you have some enhanced health and care homes in that sense. Is that right?
No, they've not contacted us.
So which home are you? Do you mind me asking which home
Cotsbench Hall. So we come under City and Shire. So we normally get the stuff from the City and the Shire because we're literally on the border.
Right, GP centre. You're not one of our Derby City homes, but what I will do is I will look in which practice are you registered with, or most of your residents?
Apple Tree.
So that doesn't fall under the City PCNs. So
I know some other ones though, because obviously I said I was coming onto here. I know some other ones have said that they would be interested because they've not really got much support in anything, and they're privately run homes.
But again, are they within the same area, or are they within?
No, there's some in the city.
Okay.
Some in the city.
If you can email me, I'll pop my email on here. Please send me through the email addresses, because I have reached out to every single home that we are aligned to. So all the 74 within the city, and it could well be that it's just got lost in that email, but there are ECPs and care coordinators, so they do have that link up to us within the city. So that's how it works. Yeah.
Thank you.
Apologies, I got dropped out there, so I've just joined back in. Great. Is just while we're having a look, is there any other questions or anything that anybody would like to raise, or anything they'd like to mention in terms of sharing their experience around supporting older people or around falls prevention within the city? Okay, fantastic. In terms of Ella and your guys' team, is there anything else that you guys wanted to pose to the group? Anything else that you wanted to raise at all?
I guess sort of this space would be really good if we could use it as a sharing platform for what's happening across the city in terms of falls in community and in care homes. And so if anyone's sort of got any suggestions about previous projects that have happened that were successful, anything that's happening now, any plans for what is starting, or if anyone's looking at it from a more local point of view rather than citywide, it's just a really good way for everyone to come together. And so obviously putting everyone on the spot, but not necessarily coming now and talking about what you're doing, but just using it sort of as that space to share what we're doing, so we're not repeating each other's work and we can work together on it. It's sort of the goal of the space. But I don't think there's anything else from, nothing else from the Enhanced Health and Care Homes team, I think, at the moment.
Well, great, thanks, Helen. And sorry, Sarah.
It's
That's okay,
me again. Obviously, before COVID happened and stuff, I was working with Move More, and we did quite a few studies within Derby City care homes themselves, and we did it over a 12-month period to be able to have the evidence of how it actually worked. One of them was actual care home, and one of them was a mental health care home as well, which was for younger adults as well, which obviously have the fear of falling. And so yeah, Move More should have all of that because I sent it all over to them. So they should be able to dig that out their archive, because it's a fantastic bit of research and evidence that we got together.
Brilliant, thank you.
Great, thank you, Sarah. So just give people a bit of a oh, Jonathan, you've just stuck your hand up and just caught me there, so please feel free to come in. You're on mute, Jonathan.
Sorry about that. Yeah, I gate crashed because I found out about this work, and I mean, Alistair, you've been involved in some of our early discussions around the importance of falls prevention and the impact of falls, not only on the individual but the impact on the system, because it's the single most highest reason for hospital attendances, and increasingly in a challenged system, falls prevention is being identified as a real focus, and that includes the care homes, but includes the people living in their own homes. And I think what we're probably trying to do and encourage partners to do is almost chunk it up and see how things can be progressed in different environments. And I think this is a really positive environment to share and learn and connect, more importantly, and see what opportunities exist. I think the biggest interventions around falls prevention might be community based going forward, and the earlier they're deployed the better, and some of those are within individuals' gifts to mobilise with a bit of education, but equally we need to look at those people who will benefit from those clinical interventions as well, and almost protecting that resource to enable that to happen. So I think I think it's a real positive space and a positive approach to share and learn. And I think there's loads of colleagues that perhaps haven't spoken today that have a role going forward in some of this. And well done everybody for organising this, I think.
Great, thank you, Jonathan. That dovetails perfectly onto what I was just about to share, which is give people a bit more an idea of what we're looking to do moving on from today. So if Adorella could just let me know for the last time that my slides are showing, that would be great.
Yeah, that's fine.
Fantastic, thank you, Ella. So yeah, just to touch on what Jonathan said there, just thank you very much all for coming along and giving you your time today. I think as we sort of tried to outline at the start, we were really keen just to give an opportunity for people to come together and hopefully learn a little bit more about some of the things that are taking place in the city, but to very much hopefully provide a platform moving forward for people to come together and either focus on some work around falls prevention or just continue the opportunities to collaborate and learn. So just to give you an idea of what we've currently proposed for this space moving forward, this is the first time that we've run this collaboration space. What we're going to be doing after today is providing before you go today and afterwards a survey for you to give us a little bit of feedback as to how you found today. So we've clearly themed today on a couple of topics around enhanced health and care homes and community falls prevention activity. Moving forward, we're keen to sort of see what else people would be interested in knowing more about, or whether there's any other teams or professionals in the city that would be keen to showcase and highlight some of the work they're doing around falls prevention. To support that, we've got a small steering group that I touched on at the start. So I know we've got most of that group on included in Catherine Anguish from the Community Falls team, who just helped to plan this first space, and we're very much looking to use that approach moving forward. So if anybody after today has really had their interest piqued by this and would like to help us to sort of shape this moving forward, I've put myself and Ella's contact details on the bottom. Please do get in touch with either of us to find out a little bit more about that steering group and what that it might mean in terms of your involvement. We are going to look to organise another sort of space similar to today, early December time. So another opportunity to do a similar sort of approach where we'd look to share some information about what other things are happening in the city around falls prevention, but we will also use the feedback that we get from everyone from today to shape what that looks like and how we use that and how we make the best use of everyone's time to sort of have this conversation around falls prevention. So that's everything from us today, but the last one is just to really make sure you guys have got the access to this feedback form. So I will pop it into the chat so that hopefully people can get it before they go off the call today, but also put the QR code on there today. It's a very short feedback form that we're asking to fill in. It's 2 or 3 minutes of your time, but please do use that as a chance just to let us know how you found today, to give us some feedback or some thoughts on how we could do it moving forward. So really keen to know if today's informed your work or given you some things to take away from, and also if we do this again in early December, how we can make sure we're sharing information in the best way and giving people the opportunity to collaborate. So if you haven't had a chance to do that QR code, give it a quick snap, and then what I'll do is I'll just put the actual web link to the feedback form in the chat as well. But just a massive thank you to everyone that's come along today to share your time. Thanks to Ella and Keith and the Enhanced Health and Care Home team for sharing their work. And as I say, please do reach out to either myself or Ella if you'd like to find out a little bit more about the steering group and how to sort of shape this moving forward, or if there's anything that's piqued your interest that you want to a follow-up conversation on. Other than that, thank you very, very much. Please enjoy the rest of your day. Thanks for joining us, and I'll just pop the link to that feedback form in the chat. And yeah, we hope to see you all again, if not before, when we sort of replicate this space in early November.
Thanks, Alistair.
Thank you.
Thank you.
Thanks, everyone.